Hello, I am Dr. Chirag Thakkar and I am here today to talk to you about umbilical and incisional hernia and its surgery. I can understand that you would be having many questions about this, like what is hernia? Should I get the surgery done? Is surgery the only treatment option? Should I go for an open surgery or laparoscopic surgery? How would be things before and after surgery? When can I start working, exercise, driving, etc. Let's talk about all these things in little detail.
I am frequently asked, what is hernia? Hernia is basically an abnormal protrusion of abdominal contents like intestine, fat, and urinary bladder through the area of weakness in your abdominal wall, that is the wall of your tummy. It presents as a bulge on coughing, lifting weight, and walking. It may also cause pain. Normally, the bulge comes out and goes back on its own. With time, it may get stuck there and stop going back inside, which is a big problem and you should immediately see a doctor. If the weakness is in the groin muscles, it is called an inguinal hernia. If it is at the navel, it is called an umbilical hernia. And if at the site of previous abdominal surgery, an incisional hernia. The protruding intestine resides in what is called a hernia sac. Normally, the intestine goes back in the tummy, but when a part of intestine gets stuck in the hernia opening, its blood supply may be cut off, leading to gangrene of intestine. This is called an obstructed or strangulated hernia. This is one of the complications of hernia and mandates an emergency surgery. This is the reason why we advise an elective or planned hernia surgery to you. If you are asking, can it be treated by medications? The answer is no. Surgery is the only treatment option for hernia. You should understand that a hole in your tummy wall cannot be repaired with medications. It needs to be repaired with stitches and a mesh. But among surgery, you do have an option of open or laparoscopic surgery. Let's talk about the difference in open and laparoscopic umbilical and incisional hernia surgery. There is a general myth that for hernia surgery, laparoscopy is not a good option and you should go for an open hernia surgery. These myths started years back when the surgeons didn't have adequate skills required for laparoscopic hernia surgery. But in today's time, with excellent laparoscopic surgical skills and technological advances, this myth doesn't stand true. The traditional open umbilical or incisional hernia surgery requires a relatively large single incision. Laparoscopic umbilical or incisional hernia surgery requires tiny keyhole incisions or puncture wounds, usually 3 in number, which results in less pain and faster recovery period. Open surgery also mandates placing a drain tube below your skin to remove the fluid and dissolved fat that is produced after open surgery. This happens because in open surgery, skin flap needs to be formed to make space for placing a mesh. If not removed by placing drains, these fluid may collect inside, leading to infection. This drain needs to be kept for 2 to 5 days, depending on the amount of fluid coming out on each day. No such drains are required to be placed in laparoscopic surgery, which helps in early discharge from the hospital. Also, unlike open surgery, in laparoscopic surgery we can see all the abdominal wall from inside, so the chances of missing another small hernia is very less compared to open surgery. This helps in prevention of recurrence of hernia. Both open and laparoscopic umbilical or incisional hernia surgery is done under general anesthesia, which will put you to sleep for the duration of the operation. You are supposed to be fasting for at least 6 hours before the scheduled time of surgery. Though, you need to take your regular heart or blood pressure medications with sips of water if they are routinely scheduled during these 6 hours. As you will be fasting, you need not take your diabetes medications. You should confirm this with your doctor if you have any doubt. If you are on blood thinning medications, you should ask your doctor whether you need to stop them before surgery. A breathing tube will be placed through your mouth into your throat to help you breathe during the operation. A catheter may also be placed in your bladder to drain urine. This will be removed at the end of the surgery before you wake up from the anesthesia. To gain access to the hernia opening, we will use sharp instruments called trocars to create 3 small holes in your tummy called ports. The location of these ports will depend on the type of hernia and our preference. Carbon dioxide gas is then pumped through one of the ports to puff up your tummy. This helps us to clearly view the contents and also gives us space to complete the surgery. Next, we will insert a laparoscope through one of the ports. Images from its camera are projected on the monitor in the operating room. We will then pass various instruments through other ports. These will be used to dissect away the hernia sac and to tack a piece of mesh over the hernia opening. In laparoscopic surgery, special mesh is used which will not stick to the intestine. Such a mesh is required as routine mesh used for open surgery can stick to the intestine and can erode the intestine. Special instruments called tackers are used to fix the mesh. This repair will prevent the intestine from slipping back to the opening. A port valve is briefly left open to allow all the carbon dioxide gas to escape from your abdomen. Finally, the keyhole incisions are closed with sutures and covered with bandages. An uncomplicated laparoscopic umbilical or incisional hernia surgery usually takes 45 to 60 minutes. After surgery, your breathing tube and catheter will be removed and you will be taken to the recovery room for monitoring. You will be given enough pain medications as needed. You will feel a bit sleepy immediately after operation due to the sedative medications given during anesthesia. You should try to move your limbs and sit up soon after surgery. Most patients can walk and go to the toilet after 4 to 5 hours of surgery. There are no restrictions whatsoever for physical movement. In fact, majority of the patients will feel much better after they have started movement. The pain also reduces dramatically once you start sitting up, moving and walking. You are allowed liquids orally 4 hours after surgery. In case you vomit, there is nothing to worry. We will stop giving you liquids and restart it after 30 minutes. Liquids may include water, tea, coffee, milk, juices, soup and dal water. If you are diabetic, you should take liquids allowed by your diabetologist. You can start all your regular heart, blood pressure and diabetes medications once you start taking liquid. You are allowed meals from the next day morning. You should have small and frequent meals for the first few days after surgery before going to your normal diet. This is vital because you may feel bloated and full if you eat large quantities of food at a time in the first few days after surgery. We routinely discharge patients in 2 to 3 days after laparoscopic surgery. Hospital stay may be prolonged for patients with open surgery or patients with heart, lung or kidney disease as per their disease status. You can take shower from the next day of surgery. Usually there are no stitches to be removed in laparoscopic surgery and you will only require a wound dressing in the follow-up consultation. You can resume your routine household and office work in a week's time as you feel comfortable. You can drive a car or a two-wheeler in a week's time. Within a couple of days, you can walk as much as you want and can climb a couple of flights of stairs. This is in fact one of the major advantages of laparoscopic surgery. But there are certain precautions to be taken to prevent recurrence of hernia. You should avoid lifting weight and rigorous exercise for the first 3 months after surgery. Persistent cough, constipation and urinary problems should be treated urgently with advice from your doctor. Depending on the size of your hernia, an abdominal binder, a kind of support belt, may be advised to you for about 3 months to support your tummy.
Hope you have got the answers to your questions. If you have any further question, you can meet me with prior appointment. Feel free to ask any question that may come to your mind. To book an appointment, call 079 2970 3438 or 84693 27634 or log on to www.drchiragthakkar.com or email me at drchiragthakkar1307@gmail.com. Wishing you a happy and a healthier life ahead. Let the inner healthier person come out of yourself.